Now, as we told you earlier, South Africa could face a crisis of ICU beds owing to the spreading deadly COVID-19 virus. Experts are warning that 40,000 people might be at risk of dying. The country has more than 17,000 confirmed cases so far and over 300 deaths from the virus. The projected total number of cases between June and November is expected to be between 1.2 million. Now, Health Minister Willem Kiezer presented the new COVID-19 model yesterday. Bhekisisa Centre for Health Journalism Deputy Editor Laura Lopez Gonzalez joins us now via Skype to unpack the modelling. Laura, thank you so much for joining me. I don't know whether you heard part of the conversation that I had a little bit earlier on, talking about these grim projections that we had yesterday. First of all, what are your thoughts on some of those projections that we could lose up to 40,000 people by September this year?
Well, I think, it's encouraging in some ways that the government is taking this kind of step to plan. And really, when you look at the team that they've assembled to do the modeling, these are very competent people who have really contributed a lot to the decisions we've made in health over the years. It is certainly a sobering set of figures. The 40,000 is really on the more optimistic side of things, so definitely a cause for concern.
It is a cause for concern, but when you look at our mortality rate at 1.8, which remains well below the global average, I suppose that also adds a little bit to that optimism, if you can put it that way, when we speak about COVID-19.
Yeah, and I think that's a great point. So what the modelers were very clear about is that the modeling is only as good as the data you really put into it. And we're only really starting to kind of figure out how COVID-19 plays out in South Africa. As we begin to know more, we'll plug in better data into those models. And so you'll start to see the results change certainly over time. So when the public sees new figures come out about this, they shouldn't be sort of surprised. It's something that they've really told us to expect.
Okay, as the Bhekisisa Centre for Health Journalism, what are you guys, when you look at the government's preparation, they needed a lockdown to prepare, and we're almost looking at 2 months now. What have you seen? Is government prepared for that peak that's coming?
I think certainly a lot of moves have happened, and I think all the modeling sort of kind of agrees on something, which is that the lockdown helped to buy us time. And the projections that you're seeing come out now are still informing how government continues to prepare. So, they made an example last night about the continued need for ventilators and how they're sort of focusing on that going forward. So I think that's a positive thing. Certainly what we're seeing kind of come out of government now, you're going to see more localized approaches to how we manage COVID-19. And also the ease of the lockdown doesn't mean that it's life back to normal. So certainly a lot of people with underlying conditions, those over 60, are going to continue to need to play it safe. And we're all going to need to be vigilant.
One of the things when we talk about the preparation of the peak that's coming, we're almost, putting aside people with other illnesses, isn't it? I mean, they're also going to need a lot of these beds that we're talking about.
That's definitely true, and it's a concern. It's also a concern that we've squeezed out people who might not need hospital beds but need other types of care. We've heard from healthcare workers. We saw it in the Human Sciences Research Council study that was recently released, that during this time, we've seen a reduction in the usage of our clinics and our community healthcare centers. So globally, people are very concerned about the impact of COVID-19 on HIV, tuberculosis, which is our leading cause of natural death in South Africa, and also on maternal mortality and women's access to contraception.
All right, thank you so much for spending a bit of time with us and letting us pick your brain a little bit there. That was Bhekisisa Centre for Health Journalism Deputy Editor Laura Lopez Gonzalez.